On Thursday, July 3rd, Milagro Solis Portillo was taken in Sherman Oaks by federal detention officers. In the melee, she was injured and brought to Glendale Memorial Hospital, which is owned by Dignity Health. The federal immigration officer's vehicle was seen parked in the ambulance area for many hours. The tires were slashed on another alleged federal agent's vehicle. Several individuals told us that ICE was inside the hospital. The security guard would not let us into the public area of the lobby, however.
Sorry.
So can I use your bathroom? You're just not going to let me into the hospital. Is it because I'm a journalist?
There's no restroom.
There's no, that's bullshit. You know what? I live here and I've been in this hospital multiple times.
Okay.
So you're lying.
I mean, we get treated here. Can't we just use the bathroom?
Dignity Health, the owner of Glendale Memorial Hospital, initially stated that they did not allow ICE into the hospital. But as you can see from this roster, these individuals from Spectrum Security are being contracted by ICE. State Senator Sasha Perez came down to the hospital to allow the family in to see their loved one and also to speak with the press.
Up for community in this way, so thank you. We just got one of her family members inside to go in to meet with her, and I know that was something that I think she had been wanting. We know that she spoke with her family last night, and she was just eager to get in there and sit down and meet with her. I think what we're just trying to just focus on is making sure that her release is done in the safest way possible, and she's getting the care that she needs right now after experiencing a medical emergency. So that's all I have to share right now. I think we're just trying to coordinate and talk with hospital staff, and just so you all know and kind of understand like what state law currently looks like. We're actually working on state legislation around these specific issues because it's kind of a hole in the California Values Act. Hospitals weren't included. I don't think we anticipated, these kinds of events happening back in 2017. The way that it works is, each hospital can have its own policy around these situations. This hospital in particular does not let anybody, immigration enforcement, into their facilities. But immigration enforcement, federal enforcement does have access to public spaces, right? And so that's where we get in these kinds of tricky situations where, we've seen folks in parking lots and some of these other spaces. So that's kind of part of the challenge that we're navigating. But I appreciate you all for reaching out to my office and just letting me know that this was happening so we could just get her family inside. And we're going to just continue to monitor the situation until she's safely released. So,
Thank you, Senator.
so right now I accompany her family members to go in to then meet with her. I did not join them with meeting with So they're currently visiting together right now, and we are very happy that hospital staff is able to coordinate that. We know that they spoke last night, and her family was just eager to see her and make sure that she's okay.
And what did they share with you last night regarding her condition and the way she was brought in here?
Yesterday evening, she was experiencing a pretty severe medical emergency. I don't want to divulge the details of what was shared with me by the family, but it was quite severe, and that's why she was taken here to the hospital. I know that her family was very alarmed and very concerned. It was shared with me, that she needed to be treated medically immediately, and so she's going to be here for some time receiving some treatment.
Quick question: the medical emergency, it was caused because of the detention or something that happened prior to that?
I'm not sure if it was caused by the detention or by a medical issue she had already been dealing with. The family did share with me that she was already dealing with some medical challenges previously, and then the situation happened. So I don't know those details at this time, and that was just based off of what the family shared with me thus far.
Did you see any agents, like from ICE or any other immigration agency inside of the hospital by any chance?
No, I did not see immigration agents or any sort of other contract agents when I was in the facility just now. Part of state law, and what I want to emphasize to people is currently in state law, every hospital can kind of manage these situations how they would like to. Glendale Memorial's policy is that they do not allow for these agents to enter into their facilities, but agents do still have access to public spaces, and so those public spaces can include parking lots. It just depends on the hospital. Could potentially include lobbies. It depends for each location. We're actually working on state law right now with Senator Detainee on closing the gap that currently exists in state law around these situations. We want to ensure that members of the public, whether they are undocumented or not, feel comfortable and safe seeking out medical care. That's very important.
That was a concern, that agents were inside and supposedly hospitals, church, schools, and so on are protected places where immigrants can feel safe. However, there's picture of these agents inside of the hospital, and that's concerning. Can you address that?
Yeah, so I'm not sure what happened prior to my time arriving here. I did speak with hospital admin, about what their rights are and how they are handling the situation. So, they've made clear that they are not allowing immigration enforcement into their private areas, into their hospital facilities. But as I mentioned before, public spaces are available, to these federal agents. So there's a careful balance that we have to follow here, especially given that this is federal enforcement. So,
Any idea when she's going to be released from the hospital?
I'm not sure on the date and time, but I do know that she is still currently receiving treatment. So
Is Glendale part of your district?
yes, I cover all of the city of Glendale.
Got it. Okay.
Do you speak Spanish by any chance? A little bit?
I do not speak Spanish. No, apologies.
fine, no, it's okay.
Anything else you want to add regarding this fear many community members are feeling about these raids and enforcements?
I'm very frustrated and disappointed that this is happening on a day like the 4th of July, where we're celebrating this country's freedom. And it's really heartbreaking that we're even having this discussion. We want to ensure that all members of the public feel comfortable seeking out the care that they need when they're having a medical emergency. The fact that people even have to hesitate to think about their immigration status is truly unacceptable. So, we're working as hard as we can at the state level to make sure that, we're delivering on that promise. And I think the hospital, here is also trying to do its part to say, when you're in here, when you're in our care, we are not going to let federal enforcement into the hospital. So I think that's also something that's really important as well. And to be quite frank, we need all of our medical facilities to step up and to be very clear about what their procedures are, and to prioritize care in this moment, because that's what our community really needs.
You're saying that we are celebrating freedom, yet many people don't feel free right now.
Yeah, no, that is very much the case. I think so many members of our immigrant community, and not just our immigrant